Over the 30 years that I've been involved in surgery, or may I say 35 years, almost all the patients who come and see me in the clinic or in my emergency department, they ask the question that why did they get gallstones and how they could have avoided it. The simplest of the answers is to the second question, that how could they have avoided it. And most of the time, you have to tell them that and reassure them that probably there was nothing much that they could have done to avoid it. In some situations, the gallstones could be formed because of high cholesterol in the circulation or sometimes infection in the gallbladder. Cholesterol can be treated with medication or self-discipline, whereas one cannot do much about the infection in the gallbladder. Bile is a fluid which is golden in color, produced in the liver, and about 500 mils to a liter of bile is produced in the stomach every day, and it trickles down into the stomach. Only about 50 to 70 mils of that is stored in the gallbladder and concentrated, so that when we eat fatty food, the signals go to the brain and come back to the gallbladder, and gallbladder contracts. And the idea is to squirt bile into the stomach so that it helps with the digestion of the fats. Sometimes when the constituency of the gallbladder is deranged, there is some sedimentation. Initially there is some sand, later it forms into stones, and then the stones can get bigger in due course. Sometimes infection in the gallbladder can also lead to the blockage of the gallbladder, stagnation of the fluid in the gallbladder, resulting in sedimentation and stone formation. But most of the time, these come or we can say that these creep in slowly and we are unaware of it. And they only become symptomatic if we have some pain or discomfort, or if we have a scan on a tummy for some other reason and it's noted that we have gallstones in a gallbladder. The latter type of gallstones, we term these as asymptomatic gallstones. So these may not be giving any problem to the patient, but they come to our attention once a scan or an ultrasound is done. An ultrasound is a scan which we do for pregnant ladies as well. Apply some jelly on the tummy and do an ultrasound examination. It's a simple, straightforward and non-invasive method of assessing the gallstones. And probably to date, this is the best examination for the gallbladder and the gallstones as well.